and I'm here at Dr. Troll's office and talking to you today about the benefits of fluoride. And the fluoride that we have here in the office is a varnish that we can place right at the gum line. What fluoride does is it helps keep the outer surface of your tooth more mineralized and hardened up. It keeps your tooth a lot stronger and it makes you a lot less cavity prone. Side benefits, it can also help with sensitivity. On children, the main reason we like to place it on children up until age 18 is their dexterity is not great yet. Their brushing maybe is not as thorough as we want to see. Lots of sugar can happen. So we're helping offset that. On adults, it's replacing old dental work that needs to be redone. So this just helps space that out. It makes it a lot less frequent that you need to have your dental work replaced. The method that we have here is a varnish. The varnish is fantastic. It sticks at the gum line where we place it. The reason that is so important is it'll stay on there for hours until you brush it off. The longer the fluoride is on your teeth, the more benefit you're getting, the more fluoride uptake into the teeth you're getting, and the more benefit. We like for people to leave it on at least 4 hours. I tell people if it doesn't bother you, leave it on all day and it'll brush off at night when you brush your teeth. Let me show you how we place it. We have 2 flavors. We have cherry or we have mint. And the fluoride it's great. It doesn't taste gross anymore. It's easy to apply. And you can eat and drink like normal with it on there. That's the benefit. So I'm going to place this at the gum line for you. And this is going to help keep your teeth even that much stronger. So you don't have to come and visit us as much, which is the benefit. Okay, so I'm just going to have you open. So we just take the fluoride and place it right at the gum line here. Just a thin coating is all. Now this is going to spread a little bit with her saliva. You can go ahead and close. It sets up very quickly. How does that taste for you?
It's good.
It's not bad.
Yeah, no.
The old flavors of fluoride used to be a little bit strong. This stuff is great. And like I said, you can eat and drink like normal. And by the time you brush your teeth, it will brush off. If it doesn't brush off until tonight, even better. The longer it's in there, the more fluoride uptake into the teeth and the more strengthening you're going to get. And we encourage all of our patients to consider it. I'm here to talk to you now about oral cancer and the importance of getting a screening at your dental office. We check for oral cancer every time you come in for your cleaning appointment. Oral cancers are typically not caught until the later stages, and we are trying to change all of that. Every year there are about 50,000 new cases of oral cancer. Sadly, about 1/5 of those don't survive it. Aside from doing the normal oral cancer screening where I'm going to palpate her neck, look around the mouth, in addition to that, we have an extra oral cancer screener called Oral ID. This is a fluorescent violet light that we can shine throughout the mouth, which detects oral cancers even earlier. It allows us to see deeper into the tissue, so we can catch things before they even surface in your mouth. It's pretty remarkable. We are pretty much the only ones that check for this for you. Even though oral cancers are not extremely common, tobacco use definitely is one of the major contributing factors. However, also the HPV virus now in middle-aged adults, an increase in oral cancers, and we're just trying to help and catch as many people as we can to keep everyone healthy. Let me start with just the regular oral cancer screening first. So what I'm doing here is I'm just feeling for any lumps or bumps, anything abnormal, or that one side of the neck doesn't feel like the other side. And then the thyroid gland is at the base of the neck, so I'm feeling on the either sides of the thyroid gland to make sure I don't feel any masses. Everything feels great there. Now I'm going to look inside the mouth. I'll have you open wide. I'm just looking for anything that looks abnormal. Any kind of red lesion or white lesion or just anything abnormal. We always like to remind the patients that any bump or sore in the mouth that does not heal and go away within 2 weeks, that's when we would want to see it, if that ever happens. I'm going to have you open wide again and stick your tongue out. And for any lumps or bumps, tongue to the left and tongue to the right. Good. Okay, well now I'm going to hit this light, turn that off, and we're going to take it to the oral ID and look a little further into the tissues. The most common areas for oral cancer are the sides of the tongue and the floor of the mouth underneath the tongue. Oral cancers are typically not something that hurts until the later stages. So that's a misconception that oral cancers hurt. They don't always. It's just up to you and up to us to be aware of what's going on, any changes. All right, so I'm going to look again with the light. I'm just going to have you open really wide. And we just do a whole look again. I'm going to check the cheeks. Anything abnormal would show up as black underneath this light. And that's how we can detect things, like I said earlier, before it even surfaces in your mouth. And just go all the way around and look at everything. Lift your tongue up. Good. I'm going to have you stick your tongue out again, please. And to the left. To the right. Good. I'm going to look a little further back. We're not done there. I like to see as far back into the throat as I can. You never know where something might be hiding, so I'm also going to look further at the base of the tongue. Okay, I'll just have you open wide again. So I'm going to move the tongue to the side and check the corners. And then this very last part, I want you to stay open big, stick your tongue out, and say, ah, ah. One more time. Ah, perfect. Everything looks clear there. I don't see anything going on. We are very passionate about catching you if there is anything to catch, because we want to keep you healthy. We will ask you and remind you of the importance of this screening. We hope that you join us in our fight against oral cancer. Everybody just stays healthy, but we're here for you. Thank you.
Hi, Connie here with Dr. Cho's Family Dentistry and Orthodontics, and today I get the privilege of talking about the benefits of laser therapy. Lasers have been around in dentistry for decades, and we have the opportunity to help our patients keep their gums healthy and also restore health to their gums with the use of laser therapy. It is a quick, painless, highly effective approach that, combined with your cleanings, can help your gums stay healthier longer. So today I'm going to demonstrate the ease and the thoroughness that a laser is when applied after a cleaning. First of all, we make sure that safety is first. The setting that I have the laser on currently is going to be a setting that helps to maintain good oral health. So America isn't feeling any pain as I apply the tip of the fiber optic light focused laser around the gums. And what this does in decontamination mode is it takes the bacterial load from thousands to just hundreds of colony forming units. Lasers serve many purposes in dentistry, and in this application we are using it on a lower setting, but still effective enough that it is able to decrease residual bacteria. Another great benefit of laser therapy that we utilize in our office is for patients who come to us with periodontal issues that require more care. Usually we hear that called with deep cleaning, scale and root cleaning. So we treat the tissues and teeth with our hand instruments and our ultrasonic instruments as usual, as we've done. Now we have the added benefit of the laser. So the process is similar. It's used when we have a deeper area. The laser tip will go lower and disappear deeper into the tissue because it's attracted to the hemoglobin and the melanin that has developed, causing that infection. And usually there's a lot of bleeding that's going on because the laser is removing and killing that active disease. We love having this benefit because we have seen tremendous results with patients beyond what we can do with our usual instruments. Patients love it because it's comfortable and it's highly effective. Again, you're getting a longer level of health with the lower bacterial count with the use of the laser. Another benefit of the laser treatment of cold sores and fever blisters, and I personally have been a recipient of that benefit, being one that suffers from them. We use it in a different setting, a little different method, but with the onset of a fever blister, you get that tingle initial feeling that you know it's coming on. Call us, schedule with us to come in. It's about a 10-minute procedure. Using the laser, we direct it around the tissue, and what it does is it kills the virus faster. Usually, it won't go full bloom, and it stays under control. There's less pain, and the length of time is cut down to like 1 day. So as soon as we can get you in to treat you with the laser for the fever blister, the better. But any time that we can treat you during the process will eliminate the chance of it coming back in that area and eliminate the possibility of it being worse. So that is why we love having the multiple uses of the laser in our office, and we look forward to offering those benefits to you the next time you come in to see us. Take care.